Today I will explain Vonoprazan to you. Mechanism of action. Vonoprazan is a potassium competitive acid blocker, PCAB, and does not require activation. It inhibits H-positive, K-positive ATPase in a reversible and potassium competitive manner. Vonoprazan has a strong basicity and resides on acid production site of gastric parietal cells for a long time, thereby inhibiting gastric acid production. Adjunctive effect on eradication of Helicobacter pylori eradication is considered to increase intragastric pH, leading to enhancement of antibacterial activity of amoxicillin, clarithromycin, and metronidazole. Therapeutic indications. 1. Gastric ulcer, duodenal ulcer, reflux esophagitis, prevention of recurrence of gastric or duodenal ulcer during low-dose aspirin administration, prevention of recurrence of gastric or duodenal ulcer during non-steroidal anti-inflammatory drug administration. 2. Adjunct to H. pylori eradication in following settings: gastric ulcer, duodenal ulcer, gastric mucosa-associated lymphatic tissue lymphoma, idiopathic thrombocytopenic purpura, the stomach after endoscopic resection of early-stage gastric cancer or H. pylori gastritis. Dosage and administration. Usual adult oral dose is 20 mg of Vonoprazan administered once daily for 8 weeks in gastric ulcer, 6 weeks in duodenal ulcer, and 4 weeks in reflux esophagitis. For recurrent reflux esophagitis, gastric and duodenal ulcer, the maintenance dose is 10 mg per day. If H. pylori triple therapy with PPI is unsuccessful, consider to change PPI with Vonoprazan. Contraindication. Vonoprazan is contraindicated in patients who are hypersensitive to Vonoprazan and in patients who are receiving atazanavir, nalifenavir, or rilpivirine. Adverse reactions. Following adverse reactions have been reported with use of Vonoprazan, including diarrhea, constipation, drug hypersensitivity, including anaphylactic shock, drug eruption, urticaria, hepatotoxicity, jaundice, rash, nausea, abdominal distension, gamma-glutamyl transferase increased, AST increased, liver function test abnormal, ALT increased, ALP increased, LDH increased, YGPT increased, edema and eosinophilia. Pregnancy. Vonoprazan should be used in pregnant women or women having possibilities of being pregnant only if the expected therapeutic benefits is thought to outweigh any possible risk. Nursing mothers. It is advisable to avoid the administration of Vonoprazan to nursing mothers. Drug-drug interaction. Vonoprazan should not be co-administered with drugs including CYP3A4 inhibitor like clarithromycin, digoxin, itraconazole, and tyrosine kinase inhibitor, and gefitinib, nilotinib, erlotinib.